Greetings, and thank you so very much for joining me today for the first podcast of Rhonda's Resource Table. My name is Rhonda Rogers. I am the president and founder of Rhonda's Promise. Rhonda's Promise is a nonprofit organization committed to the success of women and girls located right here in South Palm Beach County. Our mission is to help connect women and girls at all stages of their life with resources and skills to enhance their everyday life through education and life skills. This episode is a follow-up to our Hope is Endless brunch. I'm excited to have with me today Tracey Shipp, the owner of the First Priority 360. First Priority 360 is your local resource for insurance solutions in Florida. They work with only the most reputable insurance companies. They are committed to providing quality insurance services and maintaining a trustworthy relationship with their clients. Welcome, Tracey.
Well, thank you.
I'm so glad to have you back here today. Your presentation at the brunch was a hit, and so you had to be my first guest.
Okay.
Please tell us a little bit about yourself.
Well, like you said, my name is Tracey Shipp. I am the owner of First Priority 360. I have been in the insurance industry for 30 years. Of those 30 years, 13, I have been a licensed health and life insurance consultant. The bulk of my business, I assist those individuals who are on Medicare or on a Medicare Advantage plan. I am a graduate of Palm Beach Atlantic University. I hold a Bachelor of Science degree in Business Administration with a minor in psychology. I am the proud mother of one son who attends the University of Florida, go Gators. And in my spare time, I enjoy decorating, especially around the holiday season. I'm getting ready now for my wreaths that I'm going to be decorating, and just excited for the holiday season.
Yes, I've seen your wreaths on social media. They are beautiful, and I wish you the best of luck with that project.
Thank you.
Please tell us a little bit about your other products that you offer at First Priority 360.
So the other products that I offer are Medicare Advantage plans, Medicare Supplement plans, individual plans for people under the age of 65, dental plans, vision plans, prescription drug plans, and also life insurance.
Well, we've seen a lot of commercials out there, and you just really don't know what to believe. So talk to us a little bit about the Medicare annual enrollment period.
Yes, I'm sure you're seeing them, and as time goes on, you'll be seeing more and more and more. So what they're talking about is the Medicare annual enrollment period. It happens every year, October 15th through December the 7th. So what you can do during that time, if you have a Medicare Advantage plan or a prescription drug plan and you want to make a change, you can do so at that time. Also, if you have traditional Medicare and you want to enroll in a Medicare Advantage plan, you can do it during that time as well, and vice versa. It's also a time that if you have a Medicare Advantage plan and you want to review it, have it reviewed, that's the time to do it during that time frame.
And tell us the dates one more time in case someone missed it.
Sure, that date is October 15th through December the 7th.
Thank you. Thank you. As you know, I'm a consultant. I'm an independent consultant. And what coverage would you recommend someone like me who is self-employed?
So I would recommend going through the marketplace, which is the Obamacare plans. So the reason why I would recommend that is because most people do qualify for some type of assistance to help them with their premium. And your premium is based upon your total household income and the number of dependents that you have. So the more money that you make, the less of a assistance you'll receive. The less you make, the more money they will give you to help pay that premium.
Understood. But the bottom line is I can be covered.
Yes.
Is there an enrollment period for folks who are under 65 years of age for health insurance?
Yes. So for the Obamacare plans, the open enrollment is November 1st through January 15th of the following year. And anybody who may have missed that particular open enrollment, or they have a change in life, for example, if they get married, they have a baby, they would qualify what they call as a special enrollment period, and they would be able to enroll based upon their situation.
Okay. So let's talk a little bit about life insurance. What type of life insurance do you offer?
So the types of life insurance that I offer are term and whole life. So term is temporary life insurance. It can last anywhere from 10, 15, 20, 25, or even 30 years, depending on your age. With those type of policies, they expire after that time frame. So if you were to take out a 10-year policy, it is going to only last 10 years. And then after that point, you're going to have to get another policy. The other policy is whole life, which is a permanent policy. So those policies, you'll pay the same premium for the rest of your life. So if you get that policy when you're 20 years old and it costs $20 a month, you'll still be paying that $20 when you turn 85. You'll be paying that same premium. And the other advantage to the whole life policy is that it builds cash value. So if for some reason you need to take out a loan or you need extra money, some insurance companies will allow you to borrow against that life insurance policy.
And you gave an age of 85. Does that mean that's when you would stop paying that policy?
No, that 85 is the cutoff age that most insurance companies will allow you to purchase a life insurance policy.
But if you live well into your 90s, you'll still pay that $20.
You'll still be paying that same $20. Yes.
Understood. So let's talk a little bit about myths. We all hear stuff out there. So tell us a little bit about the myths about life insurance so we can debunk them right here today.
Right. So the main one is people think that life insurance is too expensive, but it's not. It can be if you purchase something that's outside of your budget. So when people ask me, I want to get a quote for life insurance, I usually ask them, what is your budget? How much do you want to pay, each month? They'll usually say $50, $60. And then what I'll do is I'll do my research and I'll come back and say, hey, for $50, you can get 10,000, and that's going to depend upon, their age and their health, that situation. So that is not true. So we have to remember also that with life insurance, it's not for us, this is something for our loved ones. We insure our cars, we insure our homes, we even insure our cell phones, but we don't insure ourselves. So that is one thing. If we can afford to do those things, we should be able to afford to buy life insurance. Another myth is, I have a chronic condition and I'm not going to qualify for an insurance. That's not true as well, because they do have life insurance policies now for people with chronic conditions. They're called guaranteed issue policies. On those policies, the application, there are no health questions and there are no medical exams included with those policies. And another myth would be people say, well, at work, I have life insurance. I don't need life insurance outside of work. Well, that's not true, because 9 times out of 10, when you leave that job, that life insurance goes away with it on your last day of employment. So that's a myth that needs to be debunked, and you need to get life insurance outside of your employer.
So very true. Is there an age cutoff for buying life insurance?
Most insurance companies, the cutoff age is 85. So that's the absolute last age that someone can purchase life insurance. And it depends on the company. Some say 82, some say 70. And also the youngest I've seen to be able to purchase a life insurance policy is 14 days old.
So let's talk about the other supplemental insurances. Do you cover dental and vision?
Right. So I do offer dental and vision plans, and the ones that I offer are PPO plans, which with those plans, they have a larger network and they're usually more cost effective, and they don't have a time frame as to when you can enroll in them. So if you need a dental or a vision plan, the ones that I offer, you can enroll in them 12 months out of the year.
Well, thank you. Tracey, you have provided us with a wealth of knowledge. How can we stay in touch with you and get in touch with you after this podcast?
Sure. I can be reached by phone at area code 561-329-8998, or you can visit my website at www.firstpriority360.com.
Well, thank you again for being my first guest on the Resource Table podcast. Stay tuned for our other episodes, and I hope everyone has a great day. Bye-bye.